You're listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today, we're talking about breast cancer. Let's get started. Well, good morning, or good afternoon, or good evening, whenever you're listening to this podcast. Our guest today on this episode is Dr. Christopher Spencer. He is the medical director of the Phelps Health Delbert Day Cancer Institute. He also serves as the medical director of radiation oncology and is a radiation oncologist at the DDCI. So welcome to the show.
Yeah, thanks for having me.
Yeah, so we're really glad to have you with us. Why don't to kick us off, why don't you tell us a little bit about yourself?
Yeah, so like you were saying, I'm a radiation oncologist. So I'm an oncologist that uses radiation to treat different cancers. I am also the medical director of our Delbert Day Cancer Institute here at Phelps Health. And I've been here since 2015. So I was recruited and joined while we were in the design phase of the DDCI, and then we went through and built it. And I've been, in the DDCI since we've opened up in 2017, and we're really excited about everything we've built in the Cancer Center.
Yeah, so it's a great building, and we're really lucky to have that here in Rolla. So okay. Well, as many people know, October is Breast Cancer Awareness Month, so we thought this would be a good time to talk about breast cancer. So Dr. Spencer, to kick us off, can you tell us what is breast cancer and what are the different types of breast cancer?
Yeah, so breast cancer is an abnormal growth of cells in breast tissue, or that starts in the breast tissue. Sometimes breast cancers grow in the breast and are confined to the breast, and sometimes those abnormal cells can grow in the breast and have the potential to spread elsewhere in the body and cause problems elsewhere.
Okay.
Also.
All right. So, and are there different types of breast cancer?
Yeah, so there are different types of breast cancer. The most common type of breast cancer is called invasive ductal carcinoma, but there's also precancers that are called ductal carcinoma in situ, or DCIS. There's also a type called invasive lobular carcinoma, and that precancer associated with that is lobular carcinoma in situ. And then there are other carcinomas that are much more rare, but those are the most common two types.
So can you also explain how common is breast cancer in the U.S., and do we also know how common breast cancer is here in South Central Missouri?
Yeah, so breast cancer affects about 1 in 8 women over the course of their lives. And that shakes out in the whole U.S. to being about 250,000+ cases being diagnosed every year. The incidence of breast cancer here in Phelps County is about the same as the incidence everywhere else in the United States. We actually analyzed our data recently, and what we found is the breast cancers that are diagnosed here in Phelps County, or at least at our institution, so Phelps County and the surrounding counties, we actually diagnosed more stage 1 and stage 2 breast cancers than our peers elsewhere in the country. So we're really proud of that, and I think what that means is that the women are in this area do a very good job with screening.
Yeah, that's great. So, and to catch that, because when you catch breast cancer earlier, you have more treatment options.
Correct.
So that's even greater. That's great news for this area. All right. So okay. Cancer can also be sort of a scary word for a lot of people, and so as we talked about how common breast cancer is, what is the survival rate for people with breast cancer?
Yes, I mean, that really ranges, now with all types of cancer, but very specifically breast cancer too. All of the treatment after diagnosis is tailored to the individual's actual cancer. Okay. The stage, the actual biology or molecular profile of the cancer, all of that is targeted to the cancer. So, the survival rates, can vary widely, as you can imagine, with the differing cancers. But the good majority of cancers, especially the ones that we diagnose in the very early stage 1 or stage 2, way more than 90% of women are being cured of these cancers when they're diagnosed very early. Unfortunately, there are some cancers that progress or are diagnosed in later stages that are more difficult or not possible to cure. But we have a lot of new therapies out there that can keep the cancer under control for a long period of time and give people very good quality of life, even if they're living, with the cancer diagnosis.
Okay, that's great information. So it sounds like, does it if when you catch breast cancer earlier, is the survival rate maybe a little bit more?
Correct. Yeah. So the earlier the stage, the higher the survival rate. In the statistics for survival rate, we say, how many women are alive at 5 years or at 10 years after, diagnosis and treatment. And if you catch, breast cancer in stage 0 or stage 1, that number is very, very high. Greater than 90% of women are alive and free of cancer at 5 years and 10 years. As you go to stage 2 and stage 3, it kind of goes down slightly. But even, with all the new targeted therapies we have, we're getting better and better outcomes with treatment, even for more advanced stages every year.
Okay, that's great to hear. Awesome. Okay, so. All right, so let's switch gears a little bit when talking about breast cancer. Who is most at risk for breast cancer? Or maybe you could go over what are some of the risk factors for breast cancer?
Sure. Breast cancer is difficult. One of the biggest risks for breast cancer is not having children or having children at a late age. Predisposes women to getting breast cancers. Anything that extends your exposure to the female hormones estrogen and progesterone can increase the risk of breast cancer. And some of those factors are, obesity or being overweight can contribute somewhat to having higher hormone levels. Smoking and other lifestyle choices like that don't necessarily predispose you to breast cancer, but they do predispose you to have more aggressive cancers if they do happen.
Okay. It seems like a lot of those risk factors you mentioned, they're not only for breast cancer, they're for a lot of different cancers as well.
Exactly.
So, yeah. Okay. So kind of along those same lines, how can people lower their risk for breast cancer? Are there certain maybe activities they can do or avoid to lower their risk?
Right. So a lot of breast cancer, is about screening and early detection. I think in terms of risk reduction for breast cancer, leading a healthy lifestyle, exercising regularly, not smoking, things like that can definitely help potentially reduce the risk. But the most important piece with breast cancer is we have very effective ways to screen for breast cancer, and making sure if you're of the age to get your screenings, that you're out there getting your mammograms completed and doing your screening to make sure that if something is found, it's either a pre-cancer or something before a cancer is found, or heaven forbids it is a cancer, it's an early stage cancer that can be treated without a lot of side effects or problems.
Okay, that's great. So yeah, I think that's one thing you're probably going to hear us repeat over throughout this podcast is just the importance of screening early, right, and just making sure that you can catch things early. So okay, so another question, kind of going along risk for breast cancer. Can men get breast cancer? So
men can get breast cancer, but breast cancer in men is very, very rare.
Okay.
So women have a lot more breast tissue than men do, and their hormone levels are different. Breast cancer is most often related to the female hormones estrogen and progesterone, and those hormones are just a lot lower in men's bodies. So the risk of getting a breast cancer for men is very, very low. We might see at the cancer center one case of a man with a breast cancer per year.
Oh,
so
it's
very
okay.
uncommon.
So,
yeah.
So Dr. Spencer, do we know what causes breast cancer?
So it is really different for different people, right? But any cancer is caused whenever there are molecular abnormalities in a cell's genes or in a cell's DNA. So they accumulate these abnormalities, and it causes these cells to grow without any checks on their growth. That's what causes cancer. And breast cancer, the most common cause of that growth is stimulation by the female hormones estrogen and progesterones after a cell has accumulated enough damage to be able to grow unchecked.
Okay, so that's good information to know. I think another common question a lot of people have about breast cancer: what are the signs and symptoms of breast cancer? What are some signs that patients or people should be looking for?
Sure. The most common way to diagnose a breast cancer, and especially in Phelps County, is to be totally asymptomatic and a woman just going to get her regular annual screening mammogram. Okay. That is 75% of the breast cancers that we diagnose are diagnosed totally asymptomatic. No lumps or bumps felt, just on a screening mammogram. The signs and symptoms that women can feel are, most commonly is they, self-palpate a lump in their breast. that they might notice, and many times, especially in younger women, this is followed because sometimes you can get lumps in your breast that correlate to your menstrual cycle when you're younger and premenopausal. But otherwise, when a lump is felt, we typically get a mammogram or an ultrasound, and that's what leads to the diagnosis. Other signs or symptoms could be abnormal nipple discharge, or bloody nipple discharge is another sign or symptom, or having a lump underneath your arm or above your collarbone is something that can happen as well. Changes in your nipple, like an inverted, a nipple that inverts after being not inverted previously, or skin changes, things like that are other signs that could be breast cancer.
I gotcha. So that's very interesting to me to find out that so many don't have symptoms,
right.
And it's a mammogram that actually
right. And I think that just says that we feel very strongly we do have a good screening program, and lots of women get screened, and that's exactly why we do screening, and so we can find these at when they're small, right. Not able to be felt in a very early stage.
Yeah. So okay. Can you talk a little bit about how breast cancer is diagnosed? What test would patients undergo to see if they have breast cancer? We kind of talked about the mammograms and screenings. So.
Sure. So typically we would start with a screening mammogram, and the new age of mammograms, it's a what's called a 3D mammogram or tomosynthesis, and so instead of just like a plain kind of two-dimensional X-ray film of the breast, they actually use some fancy technology to take a three-dimensional image of the breast, and it's a lot more sensitive than two-dimensional mammography. So if a mass or microcalcifications are found, the typical next step is a biopsy. They can do biopsies via ultrasound guidance, where they use an ultrasound machine to localize it, and they put a little small needle in there to take a biopsy. Or they can do what's called a stereotactic biopsy, where they use the mammogram machine to localize the area that is of concern, and they do biopsies that way.
Okay.
After you would get a biopsy, the biopsy would be looked at by a pathologist under a microscope to determine, what was going on. And, the next steps after that would depend on, exactly what they saw under the microscope.
Okay.
We typically recommend to start screening at the age of 40 and to get screening annually from 40 until 70. And then at the age of 70, we recommend, that you have a conversation with your healthcare provider, about the risks and benefits of doing a mammogram above the age of 70. And typically we recommend in people that, are very active and have what we call a good performance status, are able to do all their activities of daily living, still live independently, continue screening, because their life expectancy, continues to be, very strong.
Okay.
We also recommend screening if, women have a family history of cancer. We recommend starting screening 10 years younger than the earliest diagnosis. So, for example, if you were a woman and your mom was diagnosed with breast cancer at age 45, we'd recommend you start screening at age 35.
Oh, okay, all right. So, in addition to mammograms and other screening tools that you mentioned, are there ways for patients to self-check for breast cancer? I've heard about self-exams that I guess a lot of women can do. Can you talk a little bit about breast self-exams?
Sure. It never hurts to know your body.
Okay.
Right, and so. Typically doing, kind of regular intermittent self-exams is not a bad idea, just so that you know your body. So if something does happen or something changes, you're familiar with that change and you can address it with your primary care doctor or provider.
Okay, so. All right. So, and if you were to find something, that would be the time to maybe, like you said, contact your primary care doctor to talk about.
Exactly.
Okay.
Mm-hmm. And typically, if you were to find something, they would, order a mammogram, see you, examine you, and then, order whatever next, step would be. Likely, in younger women, a lot of times we start with an ultrasound, not a mammogram, or start with both, diagnostic mammogram and ultrasound.
Okay. So that kind of makes me think of another question. If for patients who are going through this cancer journey, who is sort of involved in this from the diagnosis, the treatment stages? Would they see an oncologist such as yourself? Would they go to their primary care doctor? I know sometimes surgeons, if surgery is an option, they might see surgeons. Who would they all kind of see?
Sure. So most commonly, especially for early stage breast cancers, the primary treatment is surgical. And so typically the types of physicians you'd see is, you'd start with mammogram. If the mammogram showed something, it's typically a radiologist who does the biopsy, who does the initial biopsy. After a cancer diagnosis is made, then you typically would see a general surgeon or a breast surgeon to be evaluated for surgery. And then you'd also see a medical oncologist who is in charge of the chemotherapy and or endocrine therapy component of treatment. And then, what I do is I'm a radiation oncologist. You'd also potentially see a radiation oncologist to talk about the radiation component of the therapy. Okay. And those are the main physicians that you'd see throughout the course of the cancer journey.
Okay, so that's great information to know. So, okay. I think that's also a great segue sort of into our next question about what are the different treatment options for breast cancer, and do they depend on the stage of the breast cancer it is?
Yeah, so everything is tailored to, not just the stage, but, what the biology of the breast cancer looks like. So, the stage goes from stage 0, which are precancers like DCIS and LCIS. Stage 1 would be invasive ductal carcinoma or invasive lobular carcinoma, or a handful of, rare other cancers. And then as you move up the stage levels, stage 2, the cancers are a little bit bigger, and or maybe involve, just a small amount of lymph nodes. But in the staging system now, they also take into account the molecular profiles. And so what we know is, the most common types of breast cancer are estrogen receptor positive and progesterone receptor positive, which mean those tumors basically are stimulated to grow by the female hormones estrogen and progesterone. Oh. There's also another receptor called the HER2 that is a growth factor receptor that also can contribute to breast cancer growth. And so those are the 3 main molecular targets that we look at when we evaluate breast cancers, and we can segregate the stage based on those markers. So for example, the same size tumor that was ER positive, PR positive, and HER2 positive would be earlier stage than a tumor that was ER negative, PR negative, and HER2 negative, so-called triple negative. And the reason that is because the outcomes for triple positive disease are so much better because we have different therapies that can target and can block those hormones in the body that reduces the growth of the tumor or any cells that have spread elsewhere in the body. Okay. So the most common initial treatment is surgical resection, for curable breast cancer, stage 0 to stage 3. And women, typically have the option of doing what's called breast conservation therapy or lumpectomy, as well as doing mastectomy. And those, cases are all just decided whether you do, breast conservation therapy or mastectomy, based on conversations with, all the healthcare providers that are on the team. Okay. To make that decision. After you undergo surgery, the surgery is taken, and the lymph nodes are also typically sampled for stage 1 to stage 3 breast cancers to determine if the cancer has spread to the lymph nodes. And then after that surgery has been done, the pathology from that, or the results from the surgery, determines what the next part of the treatment is. For cancers that are hormone receptor positive, so estrogen receptor or progesterone receptor positive, typically endocrine therapy is recommended. And so that's usually a pill and or shot based treatment that reduces the hormones estrogen and progesterone in a woman's body. And by reducing that, you decrease the risk that the cancer comes back by suppressing any potential cancer cells that are left behind. So that's one therapy that can happen. Depending on how advanced the disease is or what it looks like under the microscope, we sometimes send what's called an oncotype test. And so that's a molecular test that takes a tumor that's removed and sequences 21 genes in that tumor and compares those 21 genes to tens of thousands of other women who have already had their genes sequenced and analyzed, as well as have gone through treatment, and we know what their outcomes are. And so we can look at a molecular panel from a woman's tumor, and we can determine if they have a low risk of recurrence, a medium risk of recurrence, or a high risk of recurrence, and we can base recommendations for therapy on that. And so the most common recommendations for therapy is if they have a medium or high risk of recurrence, we'll talk to them about the risks and benefits of undergoing chemotherapy. Okay. And the types of chemotherapy that are offered are all tailored to a woman's tumor type and condition in terms of how they do the chemotherapy and or immunotherapy with the chemotherapy.
Okay. So from what I'm getting at, a lot of these treatments are very individualized. It really depends on the patient.
Correct.
Okay.
Mm-hmm. Yep. Every treatment we do is individualized because what we've learned is that it's not just about age of the patient or stage or size of the tumor. The biology of the tumor makes a really big difference. Okay. And we have lots of different new drugs, chemotherapies, immunotherapies, targeted therapies that can target different abnormalities in these cancers and do a really good job of curing cancers and keeping cancer under control.
Okay.
The last piece of treatment that we didn't talk about is the radiation therapy. So all women that go through breast conservation therapy need a course of radiation therapy to the breast to reduce the chance of the cancer coming back in the breast. And some women that undergo mastectomy, if they have lymph nodes involved with their cancer, would also need a course of radiation afterwards to decrease the chance that it comes back in the chest wall and lymph nodes.
Okay, so that's great information. Thanks for sharing all that. So, I think another common question that maybe some cancer patients may have is they're worried about the side effects of some of these treatments that you mentioned. Can you talk about maybe some of the common side effects they might have either from the chemotherapy or the radiation therapy?
Sure. So, from a surgery standpoint, the surgeries have come a long way, and, there's a lot less side effects and problems. The lumpectomies women get through, really without, hardly any changes in their quality of life, maybe just a little bit of mild pain the day of the surgery, and they get by it, with no problem. Mm-hmm. When they do mastectomies, they oftentimes will use these numbing pumps that they insert at the time of surgery that helps decrease the overall pain from the surgery and increase mobility after the surgery, and they work by basically doing a nerve block to the area that's affected. So you need less pain medicine, you're more mobile and less affected after surgery.
Okay.
From the chemo, immunotherapy standpoint, targeted therapy standpoint, there's really too many paths to go through all of the individual side effects. It really just kind of depends on exactly what drug cocktail is being recommended for a different tumor type in terms of what your side effects are. Undergoing chemotherapy is hard. It doesn't matter what type of chemotherapy it is. Okay. But over the last 20 years we've evolved a lot, and we really understand how to best manage those side effects or toxicities, and also how to best prevent them while we're giving the chemo by giving different medications and things that help lessen the severity of those side effects. And the same thing is true of radiation. When you go through radiation, the goal is to treat the cancer cells that are potentially left behind. We end up treating a lot of normal cells as well, whether it be normal breast or chest wall or lymph node regions. And, you can potentially have some side effects with those, but the modern technology we've developed over the past 10 to 15 years, we are able to really reduce the size of the treatment field and miss all of the important organs and things that are around the treatment field that used to be included and cause a lot of extra toxicity.
Okay, all right. So if patients do have maybe concerns about side effects with their treatment options, they should probably just talk with their oncologist.
Right. And we go through that in detail when they're diagnosed, but it's so patient specific. It's really hard to talk about them because some women will get through treatment with really minimal to no side effects at all, based on the tumor type and the treatment recommendations that we give. And some women end up having a lot of side effects, either because it's a more advanced tumor or the treatments that are needed to treat the tumor they have are more aggressive or carry more side effects. And so we really kind of have those conversations, on an individual basis, depending on what's going on with that patient.
Okay. So. And another question I had, Dr. Spencer, can patients with breast cancer be treated at the Delbert Day Cancer Institute, or do they have to go elsewhere for treatment? So
yeah, no, we offer a comprehensive breast program in the Cancer Center and at Phelps Health. So you can go from your initial mammogram to diagnostic mammogram, stereotactic or ultrasound guided biopsy, breast MRI, breast surgery. We have 3 surgeons right now that with Phelps Health that are doing breast lots of breast surgery, and they're all 3 very good surgeons. We have multiple medical oncologists, multiple radiation oncologists after surgery to see women through their journey.
Okay, so that's great that they can get that here. I know a lot of people they don't want to travel far, and even as you said, going through chemotherapy that can be tough enough, and then having to drive back long distances, I know that can be tough. So that's great that they're able to get a lot of that treatment done here locally.
Right,
So.
and we partner with Siteman Cancer Center. Yes. We're in their network, and so we, when we evaluate patients, if we think that they need a higher level of care that we can't provide, we partner with all of the physicians at Washington University and Siteman to make sure that the patients are receiving the care that they need.
Yeah, that's great. So yeah, that's been a great partnership, I think, over these past few years. Yeah. So. Another question I think a lot of people have about cancer is clinical trials. So does Phelps Health offer clinical trials, and how should a patient know if they should take part in a clinical trial or not?
Yeah, so we do offer clinical trials, and I'm proud to say in our clinical trials network, we're one of the highest enrolling institutions in the South Central Missouri region. So we do have clinical trials available. We have 2 full-time team members that do nothing but screen and monitor patients that are on clinical trials. So every patient that comes into the Cancer Center is actually screened for clinical trials.
Oh.
And so if they're a candidate for a trial that we have open, one of their physicians will talk to them about the trials that they are a candidate for, and the risks and benefits of doing what we call standard of care therapy versus doing therapy on a clinical trial.
Okay, so well, that's great information. So and again, another great asset another great asset that the Delbert Day Cancer Institute offers here locally to patients. So,
definitely.
Yeah. So okay. Another question I was curious about: can breast cancer be cured? So.
Sure. So so the cure word is a hard word, right? Because you don't really know you're cured until you live your full life and the cancer doesn't come back,
that's
right?
True.
But I think the long and the short answer to that is yes.
Okay.
And so when you look at statistics, the earliest stage breast cancers are what we so-called say is cured, greater than 95% of the time.
Okay.
The earliest stage breast cancers don't come back. And so what that means is, if you take a group of 100 women with very early stage breast cancer and put them through, the appropriate treatment that they need, the risk of the cancer coming back at 5 years, at 10 years, at 15 years, at 20 years is less than 5%, meaning that 95% of those women are, cured, right? Yeah. And so what's really hard on an individual basis is, you don't know, for any individual, the answer is binary. Either your breast cancer did not come back,
right,
or it does come back.
Okay.
And you don't really know that,
right,
and except for by living through time.
Okay.
And so typically, we continue to monitor and follow women, for their whole life after, any cancer diagnosis. Okay. But the statistics are very good that, most women's breast cancer is not going to come back.
Okay, that's good to know. So okay, so all right. So you mentioned maybe some of the team members that patients might see when they if they've been diagnosed with cancer and going through the treatments. We talked about some of the radiologists, oncologists such as yourself, maybe a surgeon. Phelps Health, I think, also has other support staff. Can you talk a little bit about? I know we have like a nurse navigator, we have a dietitian that can help you.
Right.
We have some of these other support staff at the Cancer Center too.
Yeah, so we have, I like to call them our Cancer Center core services.
Okay.
That we offer to patients that are treated in the Cancer Center, and so that ranges, like you said, we have a nurse navigator, which is usually like the first kind of core service that a woman diagnosed with breast cancer would interact with. We also have a dietitian that follows different cancer patients through their journeys. Fortunately, most breast cancer patients don't need a dietitian, but certainly if they do, that she's available to help. We also have a financial navigator that helps navigate patients through, the complex and, honestly kind of terrifying, financial process of, dealing with insurance companies and hospital bills and things like that. And then we have a social worker as well that, helps with a wide range of, social stresses and issues.
Okay, so that's great. I love that core team. I love that they have that. If somebody thinks they have concerns about breast cancer, where would they start?
Right. So I think, it's always good to start with your primary care provider. So if you have concerns, I think starting with your primary care provider is a, great first step. If you don't feel comfortable starting there, the immediate care clinic with Phelps Health is always available. You can get in to see a provider right away there. You can also call the breast center, and get in with the breast center for a mammogram if you want to go straight for the mammogram or try to get that done. But I think it's always smart to start with your primary care provider. Okay, sounds good. Okay, so that's going to wrap up our show today. Thank you again so much, Dr. Thank you very much for having me.
For being here. So, and for our listeners, thanks for tuning into The Scope. If you'd like to learn more about The Scope, check out phelpshealth.org.